Our group is going to be discussing COVID-19's devastating effect on New York City's low-income population. Before discussing the effects of COVID on the low-income population of New York City specifically, we first need to elaborate on the introduction of the virus to the East Coast metropolis. In early March, when COVID cases truly started to spike in the U.S., New York State reported 59,513 confirmed cases, accounting for more than 40% of America's cases and 7% of the world's, according to The Economist newspaper. 33,768 of those cases came from New York City alone. As cases rise, the city begins to shut down. Non-essential businesses and schools are closed, subways, short transporters, and the hustle and bustle of the city that never sleeps suddenly halts in the face of the pandemic. Being from New York myself, just a few hours outside of the city, I saw firsthand how the sudden restrictions and rapid rise of COVID affected the population of the state. Considering that the rest of the state may not have been hit as hard, we are still under the same jurisdiction as New York City, and the effects on our unemployment, healthcare, and overall lifestyles were all altered in a similar way. New York City quickly grew into its new title of a COVID hotspot. The cases in the virus epicenter continued to rise, and so did unemployment. 45% of low-income New Yorkers were surveyed and said that they or a member of their household had been furloughed, temporarily laid off, or lost their job permanently since the start of the pandemic, compared to a third of those with moderate to higher incomes, as reported by a study by Irene Liu. By September 2020, about 6 months after the beginnings of the virus in the city, the unemployment rate was reported at 13.9%, one of the highest rates since the 2008 recession. Due to the restrictions placed on the epicenter, low-income workers were consistently losing their jobs. Low-income jobs, like ones in restaurants, hotels, and other non-essential businesses, were closed, leaving thousands of New Yorkers without a job. On the other hand, higher-paying jobs in professional industries were able to work from home, still maintaining their careers and a steady income. In media coverage and relief policy discussions, this part of the pandemic is often discussed less. All those New Yorkers who were already struggling with low-income jobs now didn't have a job at all. Their hardships aren't reported on, and the lack of relief efforts for this specific population has left them to deal with the crippling effects alone. In my town specifically, numerous people I know were at first furloughed for months upon months, not knowing if they would ever get their jobs back. My dad, who works for a local bank that deals with primarily loaning money to local businesses, has had numerous calls daily from people who lost their jobs and were so desperate for some way to replace their income that they were constantly contacting the bank for loans, a bank that is well known in the area for dealing with local business loans and not personal ones. With this lack of employment due to the coronavirus in the city, the rate of accessible healthcare dropped for low-income communities. 22% of low-income New Yorkers who lost employment income in their household due to COVID-19 said that they or someone in their household lacked health insurance coverage since the start of the pandemic, according to a study done by Irene Liu and Elizabeth Benjamin. The overall effects on healthcare in New York City during the pandemic have been devastating. Overflowing hospitals, morgues filled with COVID victims, and extremely overwhelmed healthcare workers. Well-known attractions of the city that we can all recognize became makeshift scenes for hospital tents, as seen in Central Park. Going back to instances I've seen in my own community, the healthcare in our area, still far out of the city, saw immense pressure and suffered through the pandemic. My aunt works as a nurse for a local hospital, and during the peak of the pandemic, she worked for a quote-unquote COVID floor. Talking with her, it was easy to see the stress on our healthcare systems. There were not enough supplies or nurses to handle this pandemic. Nurses ran out of masks, there were not enough ventilators at our hospitals, not to mention the lack of space available for COVID patients. The hospital that she works in is in an area with a relatively low income and a high population that lives below the poverty line. And there were a lot of people in the area who were unable to receive a COVID test, let alone seek medical attention if they were to contract the virus. I saw firsthand the stress that my aunt was under, and that was in a hospital in a much better position than those of New York City, so I can only imagine how terrible it was for that healthcare system. Even before the pandemic struck, the low-income boroughs already struggled to find health coverage, making it essentially impossible when COVID hit. With overcrowding and pre-existing medical conditions, these low-income communities are the ones that need help during the spread of the virus. During the peak, testing availability in these communities was less than that of the wealthier parts of the city, further contributing to the rapid spread. Making tests more widely available to all zip codes could have helped avoid the larger spread of the virus in these low-income communities. Overall, many factors contributed into these communities being more affected by the rapid spread of coronavirus. Going further from the specifics of healthcare and unemployment, COVID-19 has also had a massive impact on poverty overall in the city. Before the pandemic, a bit less than 1 in 5 New York City residents were in poverty, according to a Columbia University study, as well as an estimated 325,000 children, according to the United Hospital Fund. Unfortunately, there are no up-to-date poverty rates for the year 2020, but considering how other measures like unemployment have gone up, it is predicted to rise sharply. For the individual, poverty can lead to things like food insecurity, low nutrition, lack of access to quality education, and even homelessness. It is also likely that increased rates of poverty and unemployment contributed to increased rates of depression and suicide throughout the pandemic, according to a study from Columbia University. The government should be concerned about the rise in poverty not only because many people's quality of life has significantly decreased, but also because of what it will cost them. It is estimated that it will cost over $800 million yearly to adequately support children in poverty in New York State alone, according to the United Hospital Fund. Considering all of the other factors already mentioned in this presentation, we'd now like to approach COVID relief for low-income New Yorkers and how that can be used as an example for the rest of the nation. During the start of New York City's emergence as an epicenter, it served as a warning for the rest of the country. It was going to continue to get worse in other places as it did in the city. As New York City began to shut down and implement guidelines or restrictions, the rest of the nation quickly followed in order to avoid such a massive spread as seen in the city. It acted as an example in the rise of the pandemic, so it should act as an example during the fall of the pandemic and the relief that follows. Already, the government has taken some nationwide action that in turn helps relieve New York City. Following his inauguration, President Joe Biden signed the $1.9 trillion coronavirus relief package, which is a step in the right direction for low-income community COVID relief, especially considering the bill will also extend a $300 per week unemployment insurance boost. However, there still needs to be more action taken. Let New York City be an example. It was hit devastatingly hard by the pandemic, and one round of stimulus payments will only scratch the surface for their relief. More stimulus payment rounds need to be sent to those in need, and policies need to consider further enhancing the benefits for those who are unemployed due to the pandemic. There also needs to be strong implements towards helping the unemployed get back to work. New Yorkers need to be connected to good income jobs. There also needs to be thought put into vaccines regarding low-income communities. New York City has numerous low-income communities scattered throughout the city, and due to the lack of healthcare or the difficult access to it, the administering of vaccines needs to be aimed towards those communities. Policies must ensure that vaccinations are available to the population struggling with poverty, especially considering the fact that it could help them get back to work. Let this be an example for the rest of the nation, following the footsteps of the COVID hotspot in order to ensure real relief. In other, more extensive nationwide relief efforts, the pandemic should be taken as an opportunity to pass policies that will alleviate poverty in the long term. Joe Biden's recent coronavirus bill could potentially cut child poverty in half, as according to a study by Long, which is extremely significant. More actions that will help those in poverty after the pandemic is over, like this one, should be taken.